Almost 9% of female adolescents are affected by an eating disorder. There aren't many effective treatments available, but a controversial program from the Karolinska Institute in Sweden seems to be getting good results. These experts say that eating disorders aren't in fact caused by mental health problems, but are caused by something that most women are doing at any given time.
I just felt like I really wanted to take control of my own health. So I started exercising and eating healthily and cooking my own meals, and I don't really know at what point, but it turned and I lost complete control of it and it became my whole world.
The main reason is the onset of dieting, and we say that girls, as they are taught by someone to start dieting for various reasons. And then there is a chain of events that emerges and eventually ends up in an anorexic state.
So I would wake up and delay for as long as possible eating, but at some point my mum would notice that I hadn't had breakfast, and it would happen, and it would be a quarter of a cup of a very specific cereal with the milk on and then strained off, and then half a diet yogurt. I was so obsessed with every mouthful, and I would draw it out for an hour.
Anyone can get into this problem. The evidence that this is true is overwhelming.
The eating disorder made me feel really powerful to start with. People were telling me that I looked great and I felt like a success, and that was really addictive. That feeling was really addictive.
As a first sign of starvation, you get release of dopamine in the brain. This causes the patient to feel good, and it's a very common clinical experience with any anorexic girl that she will say, it felt great, I felt stronger, and this is the typical signs of dopamine release in the brain. And that is also the reason why physical activity increases. And then you become cold, your heart slows down, and you will get captured in this anorexic state, which is very difficult to get out of. These girls are compelled to do the things they do when they come to the clinic.
I think my lowest point was I was hospitalized for low potassium, which is really dangerous for your heart and is quite a common side effect of bulimia and laxative abuse. And I was in hospital for 3 days, and they told me that if I didn't sort my life out, that I'd be dead within 6 months. And shortly after I got home, my parents sat me down and said, this is it, and we're going to give you an opportunity to go to a clinic in Sweden which is having huge success, or you are on your own and there's nothing more we can do for you. We've tried everything and you need to do this for yourself, and we're going to give this to you as your last chance. It was terrifying. It was unlike any other treatment I'd ever undergone. The environment in the clinic is really sterile, and I felt really alone when I first got there.
We teach the patients how to eat and how to perceive satiety by using a biofeedback device. Anorexics are gradually trained to increase their eating rate, to eat more and to become less satiated. And for bulimia nervosa patients, we teach them to slow down their eating and become more satiated.
The goal meal, which is about 300 grams in 10 to 15 minutes. This takes on average maybe 4 or 6 months. So then she has restored a normal eating behavior, but that's not of course the end of it. But then she might not need to use the manometer anymore, but she needs to practice how to eat together with others and eat in restaurants, social eating so to speak. But essentially you could say this is physiotherapy for your eating apparatus. So you need it's like a crutch for someone who broke her or his leg. You need it for a while, but then you want to get rid of it. No one wants to use the manometer for the rest of their life.
You can see that it goes down as you eat.
After each meal, patients rest in a warm room, as increase in temperature has an anxiety-reducing effect. And patients simply fall asleep in this warm room that could be up to 35-40 degrees Celsius. It also prevents them from compensatory behavior after a meal. Physical activity is otherwise common. To vomit after a meal is common. By putting them into this warm room, we can disrupt those activities.
Treatments for anorexia and bulimia suffer from a lack of scientific evidence. In other words, there are lots of treatments out there that have either not been studied properly or have been shown not to work. And unfortunately, not much does work. It is known, for example, that family therapy, which focuses on the family's responses to the person with anorexia, does work, but there's not much else, which means that there are few treatment options for dangerous conditions that are notoriously difficult to treat, have high rates of relapse, death from the condition, and even suicide. However, the Karolinska treatment has randomised control trial evidence to support it.
Well, the randomized trial we performed, it has three main results. The first is a randomized control comparison between our treatment and a group that did receive no treatment. This part of the study shows a strong effect of the treatment. The second part is an estimate of remission rates in a large group of patients, and that was 168 patients, and 75% of the patients went into remission in on average 14 months. The third part of the study is relapse rate in a group of 83 patients that were in remission, and only 7.8% relapsed within 5 years.
Since we started 1993, we have no deaths at any of our clinics in Sweden, in United States or in Australia, and we are very proud of that.
I think the only way that I was ever going to get better was if I made the decision on my own and to do it for myself, and I never would have been able to recover without the Swedish program. They gave me the skills which I put into place when I was ready. I worked my butt off, and every day was hard, but I was vigilant and I got my life back.